Hello everyone. Today, we're exploring the medication known as Triamcinolone Acetonide, widely recognized by its brand name, Nasacort. This discussion is designed for educational purposes. For any health-related questions or concerns, it's crucial to consult with a medical professional. Description: Triamcinolone Acetonide, under the brand name Nasacort, is a nasal spray formulation classified as a corticosteroid. Its main function is to reduce inflammation in the nasal passages, effectively treating symptoms associated with allergic rhinitis, such as nasal congestion, sneezing, and runny or itchy nose. Approved for over-the-counter, OTC, use, Nasacort is accessible for adults and children, providing relief from both seasonal and year-round allergies. By inhibiting the release of substances in the body that cause inflammation, Nasacort helps to alleviate the uncomfortable symptoms of nasal allergies. Warnings: although Nasacort is considered safe for many users, there are precautions to be aware of. It's not recommended for individuals who have recently had a nasal surgery or nasal trauma until healing has occurred. Those with untreated nasal infections or certain eye conditions like glaucoma or cataracts should use Nasacort cautiously, as corticosteroids can potentially exacerbate these conditions. Before taking this medicine. Before using Nasacort, it's essential to discuss any existing health conditions with your healthcare provider, especially if you have had recent nasal surgery or injury, an infection in your nose, tuberculosis, any untreated infection, bacterial, fungal, viral, or parasitic, eye conditions such as glaucoma or cataracts, or if you are pregnant or breastfeeding. Inform your doctor if you're taking any other medications, especially other corticosteroids, to avoid possible interactions. Side effects: while Nasacort is generally well tolerated, some users may experience side effects, such as headache, sore throat, nosebleeds, nasal irritation, or coughing. More serious side effects could include severe allergic reactions, signs of infection, fever, chills, body aches, vision problems, or signs of adrenal gland suppression, fatigue, weakness, nausea, vomiting, low blood pressure. If you experience any of these symptoms, contact your healthcare provider immediately. Interactions: Nasacort may interact with other medications, particularly other corticosteroids or drugs that suppress the immune system. It's important to provide your healthcare provider with a complete list of medications and supplements you are taking to avoid potential interactions. Dosage: for adults and children 12 years and older, the typical dose of Nasacort for allergy treatment is 2 sprays in each nostril once a day. Children between the ages of 2 and 11 years may use 1 spray in each nostril once a day. It's crucial to follow the dosage instructions provided by your healthcare provider or the product labeling. Do not exceed the recommended dose. Avoid. To minimize the risk of side effects, avoid getting the spray in your eyes. It's also advisable not to share the nasal spray with others to prevent the spread of infection. If you're using the spray for the first time or haven't used it for 14 days or more, you'll need to prime the pump by following the instructions on the packaging. FAQ: a common question about Nasacort is regarding its use in children. Nasacort is approved for use in children as young as 2 years old. However, for any concerns or specific instructions, consulting with a healthcare provider is always recommended. Closing. That concludes our overview of Triamcinolone Acetonide, known as Nasacort. This guide is intended for educational purposes only and should not be used as a substitute for professional medical advice. Always consult with a healthcare provider for more detailed information or with any questions you may have. Thank you for joining us.